116,541 people are in need of a kidney transplant today. This year, only 18,986 people received a transplant, of which only 9,504 were living donors. Evidence-based practice has proven that internet forums can increase a patient's knowledge, participation, and outcomes. A research study by Dr. Dori Segev and Dr. Laura Taylor is being conducted to further analyze the effects this has on living kidney donors. The study is called LINK, the Living Donor Information Network for Caregiving. As a participant, you will be asked to go to the LINK website, sign in, use and access educational videos, documents, and online surveys. These surveys will be used to identify areas that need continued support and education in order to make your donation experience a satisfactory one.
Together, by using our internet and our website, we hope to help guide and support patients and families as they move through the donation experience in collaboration with our comprehensive transplant team.
The decision to donate a kidney is a very personal decision and is not for everyone, but for the right people can be a really amazing experience.
The body needs a healthy kidney. Located at the rear of the abdominal cavity, the kidneys perform many vital functions, and there are many things that could go wrong with them. Remarkably, only one kidney is needed to adequately perform all of its important tasks. Transplants only occur if there's a good chance of successful outcome for the recipient, low risk for the donor, and voluntary consent of both parties. Those suffering from end-stage renal disease have two options, dialysis or a transplant. Without donors, they will spend 3 hours, 3 times a week receiving dialysis. This makes it difficult to travel, have a job, or maintain a normal lifestyle. Over 90% of donors experience no complications from transplant. A matched pair donation is an option if you are not a compatible match for your loved one. Approximately 6 weeks post-donation, you can expect to resume normal lifestyle, to resume normal activity, and to return to your normal health. For more than a century, the Johns Hopkins Hospital has had a tradition and mission of striving to lead the world in the diagnosis and treatment of disease and to train tomorrow's great physicians, nurses, and scientists. Above all, we aim to provide the highest quality health care and service to all of our patients. Rest assured, you came to the right place. Approaching from Orleans Street, you will make a right onto North Caroline Street and another right onto McElderly Street, where you will approach a roundabout that will lead you to the entrance of the outpatient center. Upon entering the outpatient building, you will be greeted by our friendly security guards. This is where you will check in. After checking in, you will continue to the elevators that will take you to the 7th floor. There, you will sign in and follow directions to the hospital clinic, Suite C. Your appointment here with us at the clinic is long. It will last from 7:30 in the morning until about 1 in the afternoon. Your morning component is where you meet all of the providers in the clinic patient rooms. In the afternoon, you'll go to various diagnostic testing, such as 3D CAT scan of your abdomen and pelvis, chest x-ray, lab work, EKG, and any other test that may be appropriate to you. These tests are located on the 1st, 3rd, and 4th floor of this building. You will receive more information and directions in your packet. Upon entering Suite C, you will be greeted by a medical assistant.
I'm the certified medical assistant here, and I will be taking your vitals. Once you come to the window, you will place your packet in the basket. If I'm sitting here, I will take your packet, and I will escort you around to the vitals area where I get your blood pressure and your temperature, pulse.
Come to see us on your evaluation day. You'll meet a lot of the providers. Of course, our job as nurse coordinators is to help guide you through the process. You'll meet with us and we'll give you some education.
Yeah, we kind of go over the pre-op, post-op information with you. We educate you on short-term and long-term restrictions after surgery, walk you through what to expect from this point forward.
And we'll have you see several providers here during your evaluation day. You'll meet with one of our surgeons, one of our nephrologists, our psychologist, and our social worker donor advocate.
We're all here for the donor. That's our job. So we go over any questions, concerns they have. with any part of the donor process. And our job is to educate you. So we want you to leave from today being fully educated so that you can make an informed decision about donation.
My job is to perform the medical evaluations for your kidney donor evaluation. This will include reviewing the history of live kidney donation as well as reviewing your medical history in depth and trying to explain to you the risks involved from the medical side of donation, and to try to make sure that the procedure is done safely and that you have a good outcome going forward for the rest of your life.
The role of the psychologist here at the clinic is to perform a full psychological evaluation in order to clear you for donation. The goal of this workup is to make sure you are mentally prepared for the commitment you are about to make.
But what we do is social work does something called a psychosocial assessment. What we're looking is at the rest of your life to make sure there's no obstacles to donation and that donation won't negatively impact anything in your world. Social work also provides support and education and information along the process. What we're looking at also is making the decision-making process, someone's expectations of donation and transplantation, if they need any additional social support, or how we can help them through this process, and put any action plans in place as needed. The independent living donor advocate has a similar role, but the advocate's role is also to make sure that we make decisions based on only what's good for the donor, not based on what the recipient needs, not based on what the team needs, and that we work in the best interest of the donor, that there's no coercion or pressure to donate, and that the decision is of free will.
If you're considering donating a kidney, what we do is a full medical evaluation before we let you go through that process. The goal is to make sure that people who donate kidneys are as healthy as they can possibly be, because we don't want you to get in trouble down the road and develop kidney disease. And so we make sure that your risk of developing kidney disease down the road is minimal, and that your risk of anything from the operation is minimal. In general, the surgery of donating a kidney is actually very, very safe, and is in fact one of the safest things you can have done in the operating room. The risk of dying from donating a kidney is only 3 in 10,000, which is the equivalent of the risk of dying from driving a car for a year. If this is the right decision for you, you're encouraged to learn as much as you possibly can about it. Give us your medical information so we can tell you if you're eligible for it, and then we would give you more information after that.
So I hope you've enjoyed this video. You can go to the caregiverlink.org, caregiverlink.org, to find out more information. And we wish you well, and thank you so much.